Good evening, everyone. This is Ryan Hoyme, aka Massage Nerd, and tonight I have a special guest. Her name is Tara Schwagmeyer. Tara is a certified massage therapist and Maya Abdominal massage practitioner. She has worked in the alternative health field for nearly 10 years and is a professional member of the American Massage Therapy Association. She is married to Carl and enjoys living in Cannon Falls area. Tara studied traditional massage at MSB Globe College and has continued on her education learning many different modalities: myofascial release, reflexology, pregnancy, cranial, geriatric, and children's massage. More recently, Tara has spent her time learning about the ancient techniques of the Mayans. This modality is called Maya Abdominal therapy. She studied in Belize, where her teacher, Rosita, lives. Welcome tonight, Tara.
Thank you. It's good to be here.
Thanks. So how did you actually get started in massage?
Well, I actually worked at MSB College in financial aid, and the massage nerd would I'd be sitting at my desk doing financial aid and number crunching, and the massage nerd would always come and get me and say, "Hey, we're giving away free massages, Tara. Come and get one." So I ended up getting a few massages when I was working at the school, and I decided to, I liked it so much, I decided to take the classes and get certified as a massage therapist right at the school there. So I gave up my financial career, and now I'm doing massage full-time. I will say it's very helpful to have a financial, a degree in financial or accounting to support my business as well. So I'm thankful for the path that I've walked. It's come in handy.
So you do all your own taxes then?
Well, I prepare them all, and I'm pretty organized with them, but no, I have someone else do them for me. I just like the convenience of having someone else file it and take that painstaking thing away from me. So. Okay. But I have it all pretty much prepared though. So.
Yeah. Number crunching. Yep.
Yes, I got to keep those habits strong.
Yep. And how did you actually get started in Maya Abdominal therapy?
Good question. I know it's not I live in Minnesota, by the way, so in Minnesota I had never heard of such a thing. It was more of a personal quest for me. My husband and I were experiencing infertility and met with the doctors, and they had told me that they had an unexplained diagnosis, so they didn't know what was wrong with my husband or myself, and we should be able to conceive, and that's always a tough answer for people. It's nice when you hear, "Oh, this is wrong and we can fix this," but we had a case where they didn't know why we weren't conceiving. And I was working with a friend of mine who's an herbalist. She mentioned that a gal in Minneapolis did something called this Maya Abdominal therapy. And I said, "Okay, well, tell me a little bit about it." And probably a few weeks later, I made a call and went to go visit. Her name was Jennifer Ingolstead in Minneapolis, who had done the training for the Maya Abdominal therapy. And when I worked with her, I found, amazingly enough, what was going on with my body. I had a severely displaced uterus. And the doctors, or my doctors all through my life, through exams, would always say, Tara, your uterus is tipped back or forward, depending on, what was going on in my body. But they always said, it's okay that it's tipped. It's normal that it's tipped. And so I didn't know any different, growing up and in my, early menses years, and even as an early adult, I didn't know that that was not supposed to be the case. Our uteruses should not be tipped. They should be nice and centered. So anyways, I went to see Jennifer Ingolstead and found out about the uterus and found out all this information. And through that quest, I ended up feeling so much better with my own body. I also suffered from acid reflux and had been, popping pills, which I hate doing, but that was the only thing that made me feel comfortable. So by massaging the full abdomen, from the digestive to the stomach down to the pelvic bone, it really opened up and let all of my organs fall back into place where they should be, released a lot of adhesions for me, and now I don't suffer from any of those things. So that's how I began with the Maya care, by receiving it myself. and going through my own healing process. And I just loved it so much that I wanted to learn how to do it and give other people the joy of feeling good. It sounds like such a simple thing, but to not suffer from a symptom like acid reflux or IBS or constant stomach pain through diarrhea or constipation, painful periods or menses, it's a joy not to have it anymore. You know, I have those pains. Yep. And I'm talking a lot about female stuff, so if anybody out there has questions on male issues, you let me know, and we'll talk about that too.
Okay, so this stuff is good for male issues too, then?
Yes, it's very healthy for men, for women, and for children. For men, the idea is basically, like I mentioned, to reset those organs and have them fall into the proper place. They get pulled through that fascia. I don't know, do you like fascia or fascia?
I like fascia. Who's your fascia?
I like fascia. Those of us that are fascially challenged.
Yeah, yeah.
Fascia gets tight throughout the abdomen. You imagine the force of a cold and coughing, and I mentioned constipation, so pushing, childbirth, you know, many things in our life cause us to stress on our organs. So when we release the fascia around the organs through this massage, it helps men as well because of the fact that we increase circulation to all the organs, which we get good venous blood flow and reduces swelling and inflammation, and that's really the key for men as well. But for kids too, for children, I do treat a lot of young teens, and a lot of my adult female clients are having me start to work on their daughters at the age of 10, 11, 12. It depending on when they start menses. And I know in the last few years, girls are starting to have their periods earlier in life rather than late as a older teen.
And I know back in the beginning you were more of a spa therapist. Are you still a spa therapist, or is it mostly the abdominal massage that you're concentrating on more?
Yes, when I first started out, I hemmed and hawed and said, gosh, what should my business name be? And I picked Spa Schwa. So that was part of my last name. And so, yeah, I did a ton of spa stuff. I did wraps and body treatments. I did hot stone. I did facials and foot massage. So I still do some of that. There's no way around it. I think that is such a nice, relaxing massage to have as part of a, kind of a bunch of different modalities, so I can keep myself busy. But I would say I'm doing about 50 to 60% of the Maya abdominal therapy, and the rest of my practice is based on other forms of regular massage therapy. Wow. So yeah, and I would never give up doing the spa stuff. I love it so much. Yeah. Gotta be Spa Schwa. Yeah. My niece came and got a massage for the first time at 9. And she went to school, and she went up to her teacher, and she said, I don't go anywhere but Spa Schwa. We joked with her. We made her a T-shirt and had a little fun with it.
Yeah. So your business is located in Cannon Falls, Minnesota, then, right?
Yeah, Cannon Falls is about midpoint between the Twin Cities, Minneapolis, St. Paul, and Rochester. So I live in an area that's a rural community. I think it's about population of about 4,000. And so I was a little, concerned starting a business here. Am I going to be busy with 4,000 people? But I found it to be absolutely a wonderful area to be in, because I'm in such a central area to some of the other major metropolitan areas and other rural areas that people do come to this area often. So I do enjoy living in Cannon Falls, and there's quite a few massage, and this area has become like a little healing mecca. So there's a lot of alternative healers here in this area. Red Wing and Northfield are close to me as well.
And then somebody in the chat asks, is male impotence, can that be helped with this?
In some cases, depending on the root cause. When I've worked with males in the past, we do go through we talk a lot about your diet, chemicals, to figure out, we try to, it's kind of like putting a puzzle together to figure out what is the cause. Is circulation a cause? Is there emotional cause to this? So I would go through a whole bunch of different questions to talk to that person about those issues. But yes, there are positive results with male impotence. Yes.
And does this technique involve deeper work, or is it more lighter work, or superficial, or?
Yeah, good question. I know a lot of people say, I don't want you to touch my belly. That's and I thought that at first too. I'm like, oh my gosh, we spend all of our lives, covering up our belly, especially here in Minnesota.
Yeah.
I don't know if I've seen sun for a long time.
Yeah.
But the work is very gentle. It is focused around the abdomen on the front, and then on the back, I do work on your glutes and sacral area to center the spine, to center the hips. So there's a possibility of a good flow of blood and oxygen. So it's very light. It is external. There's no internal massage. There are some massage therapists that have been certified in this work who are midwives as well. And so for me personally, I don't do any internal work, but if you look, I can give you the website at a later time to find other practitioners that would do internal work, like pelvic floor work or help with deliveries of babies. It can be done, but it's not part of the Maya abdominal therapy work. So it's totally separate for anybody that does extra work. It's very light and gentle, and it does not hurt at all. It's amazingly light, and when people leave, they say a very common expression that they use is, I feel lighter, and it's hard to describe that online until you feel it. It's one of those things you have to kind of try it to actually know what it feels like. But it does not hurt at all.
Okay. And do you ever incorporate this into a regular massage, or do you usually have this as a standalone treatment usually?
Yeah, usually it's standalone. There is, like I mentioned earlier, there's a lot of background work that I would need to know. So like a typical session, maybe I'll just go into that and let you know about that. Is that okay?
Yeah, perfect.
Okay. So a typical session, I would, you'd call me and let me know kind of what's going on. There's a lot of things that I need to know before we start. So I have an intake form posted on my website for men and for women. There's a separate form. And so, and then I know the issue that you're coming in for. We'll just use digestion as the issue right now. So you tell me I have this going on. You'll fill out the form, which talks about your history with diet, physical. Are there any physical issues that you may have with surgeries, abuse, whether mental or physical? We talk about your diet, like I mentioned. We talk about medications you've been on. And those are the main important things that we talk about. We go through those in a conversation. Usually the first session takes a good 2 hours. And a lot of people say, my gosh, that's a long time, but I usually run over. So my sessions end up being like two and a half hours usually. Because when we start talking, that's part of when I gather information to figure out the root of the problem. Did these digestive issues happen at a certain time in your life? And usually, we think back and say, yeah, wow, I lost my job, or I had a death in the family, or something that really touched you or hurt you. And symptoms can arise from events like that and cause congestion to our abdomens or our bodies. And so we basically sit and talk for a good half hour, 45 minutes, depending, each session is different. And then the rest of the time you're on the table and receiving the massage.
Is there any homework you have the clients do then sometimes?
Can you say that again?
Is there any homework you have the clients do?
Before the massage?
Or even afterwards too? So either before or afterwards, do you have them do certain things? Or?
Yes. We were in the Mayan, through this education, we refer to it as self-care. It's kind of like I teach you the tools how to do the massage at home. So you come in for a session, and then when you leave, I'm going to give you information on how to continue, like post-op or follow-up care type of procedure. And I teach you how to do the massage at home. And it's kind of like a diet. You know, if you want to lose 10 pounds, but you're not following the regimen, or you're eating foods you shouldn't, and you're not exercising, you're not going to get anywhere. So this work is similar to that, where you have to put into it what you get out of it. Does that make sense?
Yep.
Yeah. So, yes, they teach you how to do self-care. You can do that any time of the day. At nighttime, I typically do my self-care at nighttime because I'm one of those people who can't shut it off at night. And it's really relaxing. It takes about 5 minutes to do the self-care work on your belly. You're just doing the self-care work on your belly, not your back. Obviously, that's too hard to get to. But yeah, what I teach you is how to do that. We talk about maybe some trigger foods that aren't the best for you. We talk about maybe more water intake, less caffeine. So there's a lot to the regimen or the diet plan that I give you. I'm not a dietitian by any means, but through this work and this education, there's so much presented in these courses that you really get familiar with what's good for you and what's not good for you. And I've done a lot of studying on my own as well regarding nutrition to help add value to my clients feeling better into their health.
And then somebody in the chat asked again about another question about impotence. What types of impotence problems can be helped, like abdominal trauma, adhesions from surgeries, or any other things?
So the person's asking about impotence due to abdominal surgery?
Yeah, so that they're impotence because of abdominal trauma or adhesions or those kind of things. Can that be helped too?
Yes. Obviously, nothing is foolproof. So, like with my example, I still have not had a child or been able to become pregnant. So I'm one of those people that it didn't work for me yet, but I'm willing to keep trying. So as with that person's question, yes, there's a possibility of it helping because of the fact the abdominal massage will help break up scar tissue. If you've had major falls or even small falls, I mean, gosh, as a kid, I remember falling all the time. I mean, how many trees did we jump out of and garages did we jump down? And when we fall, the tailbone, when we fall on our rears, the tailbone is a very important part to our lower abdomen. All of those spinal nerves connect into the front of the pelvis. We have, some women have a lot more the ligaments in the pelvis to hold up the uterus. And it goes the same for men, where you fall and fall and fall, and that you get adhesions on your sacrum. Your sacrum can become stuck, and you don't have good blood flow. So as we do the massage, those areas are basically lifted and cleared. It takes time, but yes, it's all about circulation and blood flow, if you can imagine that. That makes sense.
Yep. And then who actually is Dr. Rosita? And also Don, I'm not going to even try to pronounce his last name. I'll have you pronounce it.
Don Eligio.
Okay.
He was, Don Eligio Panti was the shaman or the Mayan healer who taught Rosita Arvigo. So all of this started with Don Eligio. I have a really good book that if anybody's interested in learning more, I'll hold it up here. It's called, can you see that? Sestoon?
Yep.
And it's called Sestoon by Rosita Arvigo. And here's a little picture of Don Eligio and Rosita. Isn't he a cute little guy? But he was raised in Belize in Central America and was a very well-known healer. And he worked with this Maya abdominal therapy and also with herbs. So he healed with herbs and massage. And Rosita Arvigo is a Chicago native, a napropath, and she moved her family to Belize. And basically in the book, it talks about her story and how she began to work with Don Eligio. And she kept asking him, how odd for a Chicago native to just show up in Belize, but she heard about Don Eligio and his wonderful ways of healing and the natural ways of healing, and was very drawn to him. And so she ended up being his apprentice. And it took her a long time to become his apprentice, because the Mayan way, he wanted to teach another Mayan the work and pass it down verbally. That's how tradition. And that's, one thing I love about this work is the tradition and learning the culture and just the different ways of healing. And so Rosita moved her family to Belize, and where she lives now still, and she holds classes there, which I don't mind at all in the wintertime going to Belize to study. So I'm very thankful for her work, and it's amazing that she is a part of the teaching still, on all the classes, not all the classes, but most of the classes, the advanced classes, she is teaching and she is present, and it's amazing to learn from her. A lot of verbal for the education piece, and not book work like we're used to.
And how many times have you been over there then?
I've been to Belize just one time, and then Rosita has her headquarters in the U.S. is in North Carolina, and then she also she teaches in North Carolina and also in Oregon. So I've studied with her in Oregon and in Belize. So it was really, I can't wait to go back to Belize again to study. It was amazing. And then I want to just mention, I have a quote from Don Eligio. It's his quote that I tell a lot of people, and I have it in my publications, is, "The uterus is the woman's center. If her uterus is not in proper position and good health, nothing in her life will be right. She will be as out of balance as her uterus." Kind of a neat little quote by him.
Wow, that's, yeah.
And it makes sense when you, from a woman's perspective, or, a man's perspective too, hearing about painful menses and that time of the month. Oh, it's horrible. It's so bad. And it's hard for both sexes to deal with that many of the times. Right?
Yes.
And, one of the messages I want to get across today is that having your menses is not, it shouldn't be that noticeable. And, myself being raised, I thought painful periods were just part of life. I know there's a lot of commercials on TV that they have this little present all wrapped up, and they're like, "Oh, here's your monthly gift." And I cringe when I see that, because it doesn't need to be like that. Symptoms of a displaced uterus are, there can be many, but painful menstruation and ovulation. There's so many women that experience that. Irregular cycles. Breast or yeast infections is another cause. Miscarriages or difficult pregnancies. Perimenopause and painful menopause symptoms. Infertility and depression. Cysts. Just abnormal bleeding and clotting. And a lot of pelvic congestion and pain. So basically, our menses should be monthly. It should be very regular. It also is referred to as the moon, as receiving our moon instead of your period, because back in the day, women would receive their period during the moon phase, because the moon has a huge pull on the uterus or on our bodies. So those are some ideas about what happens if the uterus is displaced. And for men, if there's some men online too, I'll let you know about symptoms of issues with the prostate. You could have prostate swelling or early signs of that, especially before 40s. If you start noticing symptoms, stomach pain or the BPH, or erectile dysfunction, and prostatitis. So those are a couple of symptoms that men have. And then, surprisingly for everybody, some of the symptoms of this massage that would, prompt you to come for this type of work are headaches, something as simple as headaches. We have those all the time. Digestive disorders, low energy, irritable bowel syndrome, reflux, Crohn's disease, So it's a big one that has really helped a lot of people through feeling better. Crohn's disease is a huge one. Chronic constipation, low backache, and gastritis, and breathing. How many of us think about, if you've taken a yoga class and you think about how to breathe and how your lungs should actually fill all the way up down to our pubic bones and up, a lot of shallow breathing. So those are just some of the ideas of why someone may come into me or some of the symptoms that they may have. And then it kind of just trickles down into the work and how it can help. Does that kind of help you guys understand a little bit more about what my abdominal massage can help?
Yeah, and somebody in the chat asked, why would headaches be helped then?
Circulation. Headaches would definitely be helped through circulation. Yes, there's many other causes of issues for headaches, but opening up the abdomen and releasing tension and stress will help headaches.
Okay. And then what about contraindications and cautions?
Oh, yes. That's a good question. And that's part of why we do an intake form and why I talk with women and men about all of this beforehand. Some of the important contraindications are for a woman is having an IUD. We don't do any of the abdominal therapy or uterine massage on a woman with an IUD in. We also don't do the massage during menses. The stroke is from the pubic bone up to the navel. So if a woman is menstruating, and think about it, if you do that stroke, that upward motion, it would create bringing blood up into the fallopian tubes, which would cause more damage or scar tissue. So we don't do it during menses. And during the early phases of pregnancy, because working on the uterus could dislodge the fetus. Excuse me.
And is there any other things that are contraindicated?
I didn't hear what you said.
Was there any other things that were contraindicated?
Oh, yes. Sorry, you're cutting out on me a little bit here.
Okay.
If there is chronic inflammation or abdominal pain, we don't do the work, or post-surgery, or if there's cancer present. So usually someone would have to, if they did have any type of abdominal massage, we usually wait 6 weeks after surgery to make sure everything's okay. Same with a cesarean section. If someone delivers that way, we want to make sure everything is healed up. And then the other thing, like I mentioned, was cancer. We want to make sure that's not present.
Okay.
But those are the basics. There's not a whole lot of contraindications to this work.
Okay.
But to be safe, we want to make sure and do that full health history and make sure we know exactly what's going on inside someone's body before we start.
What about the medical profession? What do they think of this style or technique?
We're beginning to hit the desks of physicians, I guess I should say. I think the whole natural therapy is starting to get attention, and in a positive way. I personally work with quite a few medical doctors, and I think it's just it's going to take time and experience, and people in the medical field are going to receive this work and hear about it from their patients. And I think that's the important part, is for anyone who's received this work, whether you've had good or bad results, I like to hear about it. I stay in touch with my clients all the time. But to make sure you're telling your doctors who maybe you saw prior about any of the symptoms I mentioned, and all of a sudden, wow, I feel better. It's so great to spread the word that this helps. I've had quite a few clients come in and they say, gosh, Tara, I've had scopes up and down. I don't know what else to do. I'm broke. I've spent all my money on tests, and there's nothing wrong with me. There's no diagnosis. This is a last resort. I found this on a chat group or an IBS group or an infertility group. So the message about Maya abdominal massage is out there. And so the medical field is slowly hearing about this. And so it's nice when someone comes in after they've been through, in and out of so many hospital doors and testing facilities and poked and prodded, that we can care for them and do gentle massage and be so nurturing. It's just a different environment than our medical field. I love the medical field. I'm not knocking it. So I absolutely love having medical doctors, but I'm so excited that the Maya abdominal massage and regular massage and acupuncture and just all of the fields in the health field or the more natural fields are becoming more present with medical doctors.
And honestly, back in the day when you first told me about that you were going to take trainings in this, I thought, in Minnesota, yeah. But the thing is, I supported you, of course. But the thing is, it's just amazing. Yeah, it's just amazing how much you've grown with it, and you're actually performing it more on a regular basis and stuff. I mean, it's just amazing.
Yeah, I was pretty nervous about it too. Going from I did massage therapy, but I had the corporate world to support me as well. And so I was doing for many years, I did massage therapy at night and on the weekends. But I had this draw to this Maya work because of the experience I had with it. Like I said, I had such severe acid reflux and painful periods that I was one of those people that said, oh my gosh, how do I get better? I can't stand this. And, my husband couldn't stand it either. But it was one of those things, I took a leap of faith because I knew how good I felt from it. And I think that makes me in turn a better practitioner, knowing what this was like for me and going through the healing process as well. I can understand what someone's going through. Being very dependent on pills or anxiety medicine if you have depression. And that's one thing I didn't mention here. It's about the abdominal massage. In our center of our abdomen, we tend to hold a lot of emotion, whether it's good emotion or bad emotion. When you're the best example I can give, when you're given bad news, it's like a punch in the face. And then what do we do with it? I was raised like, don't cry, it's okay. We hug each other and wipe the tears away. It's the first thing we do. But when we do that, those emotions do get stored within our bodies. And so pain, just from physical pain or emotional pain, a lot of that can be helped as well with the abdominal massage.
Yeah, because in Minnesota, we're considered Midwest conservative, I would say, because I mean, we spend maybe two months, 2 months out of the year maybe in a bathing suit, if that. So.
Where are most of the listeners from today?
I know there's one for sure from Canada. So even colder than us.
Yeah, I was really nervous about jumping out of the norm spectrum of just doing regular massage. But as a gift, at the end of this, I'm the only practitioner in my area within 50 miles. So it's been an amazing thing. But also being the only practitioner, I'm very busy and I need to be available, for clients that are coming from long away, destinations. So in Minnesota, you're right, it's not as popular here as in the East or West Coast. But there are a handful of other practitioners in the Minneapolis area still, which I appreciate. There are about 300, I think, Maya abdominal therapists within the U.S. and overseas. And so we do have a really nice support group. Being a small group is a good thing too. And we use each other as references for questions that come up. If I have a new experience or a new issue, I have someone right there to ask, basically by phone or by email. Rosita Arvigo's office is always available for me for questions. So I don't feel like, here, you took the class, Tara, we're done. It's really nice and supportive through all the other practitioners as well as the teachers.
And does Rosita, is she the only one that mainly teaches advanced stuff, or do other practitioners teach that work too? Or
Yeah, how it starts out is if you want to become a practitioner, you have to go to a self-care retreat. And that's usually a 3-day weekend. So a Friday, Saturday, Sunday, full days. And you're introduced to the technique. You learn the anatomy and physiology. You learn techniques just to do on yourself. And then after that, you can make the decision if you would like to go farther. So after you take the self-care class, you are not authorized to do any of the work just because there's so much to it. The second step would be taking what's called the professional course. And that is taught by, now it's taught by 3 or 4, I can't recall, women and men that Rosita has groomed for that position because she's not teaching the professional level anymore. Then the next step in that professional class is a whole week long. There's, like I said, many different locations in Oregon and North Carolina. I'm not sure if there's any more yet. But so the next step would take another week class. And then after that, you can choose or not choose to be certified. I chose to be certified. And what that entails is writing up or seeing 25 different clients, some multiple, some repeat times, some single times. And so working and writing down and just doing some certificate or some case studies basically, and reporting those into the office, the Arvigo office. And then I have someone that is assigned to me to go over things with me, over questions, over, good things, over bad things, things that I may not have remembered to do, or just the part of the learning process. So I have a lot more skill behind me because of the questions I was able to ask and work with these gals. So I did choose to get certified. Like I said, you don't have to be, but it was just something I really wanted to do and felt comfortable doing. And then there are other modalities like people like myself who have gone through the entire case or the program, but we have an interest in learning more. There's always that. I want to learn more.
You're addicted.
Yeah. Good thing. So I just actually, Rosita has developed a pregnancy course. And so I just got back last fall from an advanced pregnancy course. This path has generated just more business for me with you start with the infertility, and then guess what? People get pregnant, and then and then I work with them throughout their pregnancies. And so it's been an amazing path for me to have more education from a teacher that I trust fully. I trust the work. Yes, I've added in some of my own, some other of my other modalities to my massage and my other learning. You always do that. You kind of have your little knapsack full of education and things that you like to do for your clients and things and success stories at work. But her program is very well done. It's easy to understand. Like I said, it's a verbal type of education. It's not all read this book and, we're going to have a test on it. And that was one of my favorite things about the course is the one-on-one help you get. Like most programs, we did have other practitioners that worked with us. We would be on massage tables. There's nothing that in this class that I have not experienced myself, that if I do something on a client, I know I've done it myself. So I feel really confident. And I guess that's the message that I'm trying to portray is you feel good leaving the class. Like it's okay. You feel comfortable actually starting to work on a new client that may come in for erectile dysfunction or acid reflux or infertility right away. Yes, time helps, just like any other type of modality, helps you feel more comfortable, but it's a nice class to leave and feel comfortable.
And then with the whole pregnancy class, and does that help through all the trimesters then, or do you still try to stay away from the first trimester then, or?
Yes, I do. We don't do any work through the first trimester on the uterus. I do regular massage on the moms though. just to get them prepared and relaxed. After the first trimester, we do start doing the Maya work. There are contraindications as well throughout the pregnancy. We don't do a lot of low back and sacral work on moms until they're ready to deliver, because that can initiate delivery or initiate labor, excuse me. But I've since I just finished the pregnancy class in October, I've worked with about a handful of women through their pregnancies, not quite through all the way through the pregnancies, but using this technique. But the results are amazing with shorter and faster deliveries. So I don't have the stats with me right now, but we can look them up online at another time. But the stats do show less pushing and much quicker delivery, which is awesome. And the other thing that, major complaints during pregnancy for women is low back pain. The round ligament is so stretched out. They have pain in the groin area and just in the front of the belly. The fetus pushing on the bladder. So when a mom's very low and pendulous, the pregnancy massage, the Mayan way, lifts the uterus. So we always want the uterus nice and close up to the mother's body instead of hanging out in front, pendulous. And so, being that, if a baby's hanging out in front of the mother, where's the path for the child to be delivered? There's no easy path. So if the uterus is pushed up next to the mother, close, she's going to feel better for her digestion, upper and lower. She's going to be able to breathe better. The baby's going to have a better fit, basically, and have room to grow and room to move. And he or she's able to find that pathway out the vaginal canal and not be in so much stress. And so, with that said, our babies are also shown to be healthier and I guess faster recovery for the mother as well.
And is there also postpartum stuff you can incorporate too?
Typically, we don't work with anybody, and I'm talking about me who's not a midwife. So if you are a midwife doing this work, you do see a woman sooner than I would. But yes, postpartum, if it's a vaginal delivery or a C-section, again, we roll into scar tissue. We roll into emotional trauma from delivery and just general healing. So 6 weeks after, with a doctor's consent if there's been any issues with the delivery, and we start working with bringing that getting that uterus back into a good position for her, and kind of we work on what happened with the delivery and throughout her pregnancy. There could be a lot of scar tissue.
Okay. And then somebody in the chat also asked, can it help with sluggish bladder, gallbladder?
Sluggish bladder?
A gallbladder, she says.
I guess I've never had that question come up.
Okay.
Maybe she can give a little more detail on that question.
Okay. I'll wait for her to respond.
Okay.
But also with many other abdominal kind of issues, even bladder issues too. But UTIs, you'd probably stay away from then.
If there is an infection present, yes, we stay away from doing the massage during the infection. So if someone has an infection and has gone through a round of antibiotics, then we start on it. Also, I guess this is a good time to mention, I had mentioned earlier about Don Oligio and working with herbs. There are a product line that Rosita Arvigo has developed called Rainforest Remedies. And they are herbs from Belize, and any Maya practitioner can receive the herbs and make the tinctures. So there's many different tinctures that can help with a lot of these different issues. With sluggish, I know the one gal was asking about a sluggish bladder, but we have Rainforest Remedies can help with clearing out if there's issues with erectile dysfunction. We have one called Male Tonic that kind of cleans out the lines, if you will. We have a blood tonic. There's an immune boost. There's a flu away. So there's many different types of herbs that we haven't heard of here in the United States, but again, they are amazing, and our bodies aren't used to them. You know how we take antibiotics and we get used to antibiotics, and we no longer respond to them. And so this line of tinctures has been amazing that I do don't prescribe, but I give to my clients along with the abdominal massage as well.
Okay. And the lady responded, can this work slow down formation of gallstones, help with organ work more efficiently if a person is symptomatic?
Yeah, and I can't repeat it enough, but I'm sorry if it sounds like I'm repeating, but when our organs are in proper position and are receiving good blood flow, things will fall into place. So if you are chronically having this condition, we would talk about what's happening. You know, I would need to, or you could find a practitioner to kind of get their hands on your belly to see where is their tension. Talk about your diet. What are you possibly eating or drinking that could be aiding and abetting these gallstones? So yes, by all means, it will help with circulation, and in turn let those organs breathe and work the way they're meant to work. But when there's congestion, sorry.
Oh, sorry. And what about hysterectomies?
Yeah, good question. I know a lot of people say, well, why, I've had a hysterectomy. You talk about the uterus all the time. I don't have a uterus to massage anymore. Scar tissue, and sometimes women don't have a full hysterectomy, so their ovaries are left, and it's really nice to massage post-surgery for scar tissue as well. So by all means, a woman with a hysterectomy should come in and get an abdominal massage if she hears about it and is drawn to it.
And even cesarean sections too, so it helps with that too, would you say, with the scar tissue? And
yes, scar tissue, and for even a hysterectomy, or for someone who may have cysts. I've worked with some clients who have had very large cysts removed abdominally because they were too large to remove vaginally. So post-surgery is an amazing thing for many different types of surgery to remove that scar tissue to make sure everything is circulating the way it should.
And then let's say somebody's kind of interested in this technique, but let's say they want to leave their clothes on or something, or leave their underwear on, or you can work around all those things then?
Absolutely. Being a massage therapist, I guess in school when I started out with you, Ryan, you don't ever have all the education or answers until you've been in practice for a while. In turn, I've been working with a lot of men and women who've had physical abuse, just because this work does help many, many, many symptoms. So yes, that is a huge concern, and a right concern to talk about with your clients. If someone has physical issues and first of all, they don't want to be touched because in the past, touch was bad. So when you ask someone to take their shirt off and just expose their abdomen, that's a big deal for some people. And some people are like, yeah, that's fine. So being very politically correct, or whatever you want to say, just to be very cautious and understand and think about who you're dealing with and what their past has been. But no, you don't have to take off your clothes, to answer your question. I kind of went into a ramble there, but I think it's really important to mention for everybody,
Yeah.
for everybody to just be really cautious and don't push. So, but no, you don't have to take your clothes off. Obviously, it's a better massage, and it's easier for me to feel the position of organs or the position of the uterus without baggy clothes. But yes, we can always do the work with clothes on.
Okay, and then you talked earlier about the rainforest remedies. I mean, are is it mostly herbs then that are involved in those then? And do they make them overseas then, or they make them mostly in the United States? Or
Um, they are collected in Belize. Part of the education when I was in Belize with Rosita, we got to do a walkabout. And I was like, what's a walkabout? And we got to walk through the rainforest, and she pointed out all these different trees and bushes and plants. And we learned, during that walkabout, we learned about the wild yam. And the wild yam was one of the first methods of birth control. So obviously now it's been modernized and chemicals have been put into it, but there's just one example of a healing herb. But through the rainforest remedies, they are collected in Belize by Rosita's organization and shipped to each practitioner directly. So yes, I can buy the tinctures already made up in bottles, or I can buy the herbs and make them myself at home. Overseas, there are practitioners overseas. I'm not exactly sure where someone's asking about, and I don't have the information as to where everybody is. But you can look online. Rosita's main website is arvigotherapy.com. And on that website, you can find a list of all the practitioners. You can ask questions. You can see forums. And basically, there's question and answers on there for you.
And for those remedies, it can help many different ailments and problems, would you say? Or is it for specific things or more for general?
More for specific things. Yeah, and I do give them out to certain clients depending on what their issue is. Sometimes we do like to take a medicine because we're so used to that Western medicine. But the herbs are such a nice healing prescription, if you will. Excuse me, too much talking.
And what kind of success stories you've had with clients?
Oh, so many, and it's awesome to be able to say that. Like, it makes me feel good to be able to say that. Like I mentioned earlier about the people who have come in, I have a lot of baby boomers that, every practice is going to have common symptoms or people coming in for the same type of issue. But a lot of digestion issues where, chronically women will come in or men will come in and say, I have just had IBS my whole life. One comes to mind right now. I'll talk about this client. She didn't want to leave the house to go out to dinner with her husband or out for fun, out for a walk. She didn't want to leave her house because she was afraid of having to go to the bathroom. And I worked with her a couple times, and she came in and she's like, I've tried everything, Tara, and I heard about this, and she's like, well, it's not going to hurt. I've tried everything else. I said, all right, well, let's talk and we'll get started. And I worked with her 2 sessions, and I saw her out at a community, like a breakfast we had. And I was just floored that I saw her. She was out smiling, and she was walking around, and she was like 20 minutes from home and not nervous about, and that sounds, like a small thing for the people who don't have issues with that. But when you're locked in your house because you're afraid of having to go to the bathroom, it's not a good thing. And so that is just one story that now she can go out, she can go on trips, she can go do things with her friends and her family and not feel worried. She put the care into it. She did her self-care regularly. She'd tell me, sometimes I realized I wasn't doing the self-care. I get a little lax when you feel better. When something doesn't hurt, we're not complaining. And so that's a reminder. The symptoms will come back. Like, even for me, if I don't do my self-care, I have acid reflux. That's just my body. That's just who I am. So it reminds me, hey, it pokes me and says, do your self-care. And I get back into the routine, and then I feel better. So yes, there's many success stories, whether it be I've been trying to conceive forever and I'm pregnant. Digestion is another big one. Cysts and fibroids, recovering from surgeries and not feeling good are other big success stories I've had. And I just thought of this. I think I'm going to mention it. When I work with couples for infertility, or if I work with a man, and I'm just saying this as a female practitioner, a lot of the times to just move away any awkwardness, if a gentleman comes in, or a woman, there's no sexual ring to this work at all. Okay, so there's no touching of the penis or vagina. And when I do have a new couple come in, or a new man or a new woman, I always ask, would you like your spouse, or would you like your boyfriend or girlfriend or partner to come in with you? And I don't want to say I enforce it, but I strongly suggest that the other person comes in, because even the person on the table is uncomfortable because it's a new thing. And it's just nice to have for the person receiving the treatment, or it's nice for the person, the spouse or partner, to know that your partner is being taken care of and it's safe. So, and then also that's a good thing for me, being a female practitioner, to have that safety net as well.
Okay. But with self-care things, do you give actual diagrams for them to do for self-care, or you just show them some techniques and then they can go home and perform those then?
Oh yeah, during the session, I actually will put my hands over the top of their hands and let them feel their bodies. So if it's a woman, I will say, here is your uterus. Can you feel that tissue? Okay. So I'll show them where it's located. Is it left or right or forward? We typically can't feel a uterus that's tipped backwards. But so I'll let them feel what it feels like. And we'll do the work together. It just takes a couple minutes to show how to do the self-care. And then, yes, I do have a handout that I will give to each person that has a whole detailed description of how to do it, how many times to do it, the pressure to use, when to do it. And I think it's good to have that, because during a session, we're kind of zonked out. And during the sessions, I don't like people to be thinking, how many times do I have to do this? And being in a whirlwind of, am I going to do this right? I'm nervous. And so we really talk about, how easy it is, and just, it's one of those things just to get comfortable with. I mean, a lot of the times we fall asleep I do anyways, fall asleep with my hands on my belly anyways. It's a natural thing to do. And so just showing how to do the techniques, and every time somebody comes in, I always ask, do you feel comfortable with your self-care techniques? Do you like doing it? I had someone come in for the first time about a month ago, and she came back the second time, and she said, Tara, my wrists really hurt. I have carpal tunnel. And I said, okay, well, let's just modify it a little bit. And so, yeah, we think about all those different things that can happen during a session. And during your post-care, it made her wrist feel funny. And so we just modified how we had her hands when she was doing her self-care.
And treatments, when they come back on a regular basis, are they usually an hour long or half an hour long?
Usually an hour or an hour and a half. I guess I've personally never done a half-hour abdominal session. A lot of the times people or clients want me to work on more than just the abdomen, neck, or if they have an injury. So a lot of the times I do combine my work with more than just the abdominal massage. But for repeat sessions, it's I don't know, it's about 50-50 between that hour and the half hour. The hour and the hour and a half. But every time they come in, if it's a first-time session, it's mandatory. They have to do a 2-hour session with me. And like I said, I usually need more time than that anyways.
Okay. And on Rosita's website, is there a place where you can locate practitioners throughout the United States then?
Yeah, on arvigotherapy.com, there is on the top right-hand side, I believe it just says Find a Practitioner. And it's a pretty nice website. You can go in and just type, like, say you remember, I saw this girl on the Massage Nerd show and her name was Tara. Just type in Tara, or if you remember Minnesota, just type in MN and click Find, and then it'll pull up everybody for you. And then on there is also listed as well who is a certified practitioner, who is gone farther with teacher training. That's one thing I didn't mention. Like my next step, if I choose to become a teacher, to teach that self-care, the first course that I mentioned earlier. So the stats are marked on there, like all of your, like LMT, CMT, practitioner, certified or not. So all the stats are on there, and really on the website, like I said, it's a great website. There's a forum on there if anybody has questions that you want to ask. It's just really organized nicely, and it has all like the list of frequently asked questions if you want to. Actually, everybody who calls me, when I talk to them, I always say, hey, check out the website and think about if you have any questions that come up, because really, if someone's calling for acid reflux, there may be some piggyback or some backpacking type of symptoms that affect the acid reflux. So it's good to start, when you look at the website, you can kind of start thinking about, wow, I think I do have this going on too. So multiple symptoms are there as well, as just one.
And then people that were physically abused too, I mean, especially sexually abused too, do you deal with a lot of those type of people, or is this work really geared towards that too? Because you'd think that the abdominal area and the pelvic region, that's more protective, and then they're protecting during their actual abuse and things. So.
Yeah, I would say it's not geared towards that type of injury, if you will. I'll just refer to it as an injury because it is. So it's not geared towards that, but I do see quite a few clients, and it's my basis who's referring to me. If I see somebody for infertility or digestion issue, and they say, wow, this feels really good, I think I'm going to tell my sister. And she was abused. And is that okay, Tara? And I'll say, yeah, have her come in. And so every session is a different session depending on the issue at hand. And so, yes, I do see people that have then been physically or emotionally abused. And yes, they are very protected. Some aren't, some are. And so just being very gentle and understanding of what happened. Sometimes it takes longer than just somebody who comes in for a digestive complaint, IBS, may, if things go well and the diet's followed and exercise is followed and they do their self-care, they may have 2 to 3 sessions and they don't need to come see me anymore for a while. But someone with an abuse issue may need to come multiple times depending on what's going on. Did the abuse cause injury to the vaginal area? Did it cause injury to the uterus? Is there erectile dysfunction because of abuse? So there's many different things that abuse that can help with the abdominal massage, receiving that. But being gentle and very aware of what's going on is a very important part of any practitioner that does that type of work.
Okay. And then how do people get a hold of you if they want more information from you then?
A couple of different ways. They can call me. I'm at a public office in downtown Cannon Falls, and it's called Acacia Studios. I had a brochure here somewhere.
Is it a .com or .net or?
Oh yeah, it's .net. Thank you.
Yeah.
Here's my cute little brochure, Acacia Studios. It's got a little tree on it.
Aww.
Acacia tree from Africa. It's a sheltering healing tree, so it's kind of a neat thing. So I'm at Acacia Studios, and so it's Acacia Studios with an S.net. My phone number here is 507-263-7957. And then I've also kept my own identity as Spa Schwa. So Spa, SPASCHWA.com is my personal website that you can find me at there. Or you can go to the ArvigoTherapy.com website and get a hold of me there as well. Okay. And then I want to mention, too, I had one other book to show you. We were talking about the rainforest remedies. Rosita has this book, The Rainforest Home Remedies. So it talks about the actual rainforest remedies that I was talking about with the tinctures, but also it's a really good book for healing at home. Like there's an example in the book about a woman with chronic uterine infections, and you use corn silk tea. So you can go out and shuck some corn and boil the corn silk, and that's an easy fix. So there's a lot of neat home remedies in that book as well.
Cool. And is there any other things that we did not cover, do you think?
Oh my. Gosh, I don't know. I think we covered quite a bit of stuff.
Yep.
I think that it's important, I'll just mention that, if you have some severe symptoms, I think it's important for you to, look at this work, check it out to see if it's right for you. Make sure you back yourself up. Ask questions of your medical doctor or whoever you see for your care. And just like I like to work in conjunction with a medical doctor or a nurse practitioner as well, because there's a lot of maybe records or x-rays or blood work that I don't see. So, even with fertility testing, I usually have the male go have his sperm tested. And so we talk about working with many different practitioners. So I don't just work solely. I work with a lot of different people in the medical field as well to gather all the information we have at hand. So, yeah, I think it's good to just get things checked out before just seeking any type of therapy. It's always good to ask questions and be really an advocate for yourself.
Yeah. And I just want to finalize that I'm so proud of you. I mean, back in the beginning, I thought you were just going to do it here and there, but you're doing it full time for this therapy, and it's just an awesome thing to see all my students blossom. So.
Oh, bless your heart, Ryan. That's really nice to say, and I think part of my success is you as well. You've guided me so much and been there throughout my career. 10 years we've developed a friendship, but also you've been a mentor for me as well, and thank you for that. You've stayed in touch with me, and you always have time for my silly questions. So thank you for being there, and I know many of your other students feel the same way. It's just a blessing to have you in our lives, too.
Thank you, Tara.
Yeah.
And thank you, everybody, for participating tonight. So again, if you need to get a hold of Tara, just make sure you go to acaciastudios.net or spashwa.com. Okay?
Thanks, everybody.
Thank you. Thanks, Tara.
Thanks, Ryan. Bye-bye.